So I'm Guillermo De Velasco. I'm medical oncologist from University Hospital 12 de Octubre, based in Madrid. And we've presented the data from CABOPRE that this was a phase 2 clinical trial where we were trying to evaluate how were the outcomes with patients with Cabozantinib prior cytoreductive nephrectomy. The main endpoint of this phase 2 non-randomized trial was the response rate. And what we've seen is that basically 1 out of 4 patients achieved a response, a partial response. So this compound that we are not thinking about this tyrosine kinase inhibitor use as monotherapy, because now with all the new combinations we are using the Cabozantinib, we will be thinking about Cabozantinib use with combination of nivolumab. But I think this has been probably the only study that has provided unique information about Cabo prior cytoreductive nephrectomy. So this is a small study, because one of the most interesting things is we were trying to understand which patients respond to single tyrosine kinase inhibitor and to this new novel tyrosine kinase inhibitor, not only targeting the vascular endothelial growth factor, but also the c-Met and AXL. So one of the endpoints that we've seen is that in this population that is intermediate or poor risk, the median PFS was 12.7 months, which is quite remarkable thinking about this kind of information. And also this type of trial, it's allowing to select which patient should undergo cytoreductive nephrectomy. So not every single patient, because one of these patients who started on Cabozantinib had progressive disease. So that was a patient that potentially should have undergo a cytoreductive nephrectomy up front. And definitely when you are starting a treatment up front with systemic therapy, you may help to select which patients may benefit with treatment, and in this case with Cabozantinib. Something very important with this trial is that we are doing at this time analyses to try to understand how are the changes in the plasma and in the exosomes from the tumor to see whether microRNAs may predict response to Cabozantinib.